what started making the pennies drop for you on reconsidering some of this?
Well, somebody blew the whistle. This shit was not my fault. And I don't think I would have transitioned had I not been abused. I was a gender non-conforming kid. I watched all these people's transition diaries on YouTube. And I think the first 5-6 years, I was really all about it. I have all these feelings, and they're just all under the surface. But most of the time, I just look angry. Like I suddenly was attracted to men. All the way up to now, I'm doing an assessment in my mind. Do they know that I'm a female? Do I miss my breasts?
I mean, we do see some non-binary TikTokers take tea, but they keep their hairy breasts.
She shows me this article and I die. I just shut down. I was not even willing to have a conversation, in denial about myself. I really thought Jamie was transphobic.
I wish I was more open-minded. When I said that, I was like, okay, it's time.
Okay, Roxxanne Tiger, welcome to my podcast. Thank you so much for being here.
Thanks for having me.
No problem. So you are a female to male, trans, now detrans after 12 years, which is what I understand. And you have quite the story. I know that it ties in with Jamie Reed as well, who blew the whistle on a youth gender clinic. And yeah, I guess today I'd love to hear about your story, your journey, what's led you to where you are now. So we'll start at the beginning, or wherever you feel is a good place to start, I guess.
I was a gender non-conforming kid. I was always a tomboy, always, played with the boys, fought with the boys, ran around, played basketball, did very athletic growing up. And I remember I got a very short haircut in second grade. And when that happened, it was on. Are you a boy? You're a lesbian. What are you doing? From all the kids that I was in school with. I had adults at the school, asking me if I was a boy or talking down to me. Oh, why don't you wear skirts? That kind of thing. I mean, it was 1986, 1987, and so it was terrible to be gay, even let alone gender nonconforming. And I just kind of stuck to my guns growing up. I just didn't care because I liked what I liked. And often I would wonder why I wasn't a boy and that kind of thing, or think about why don't I have a penis, or, that kind of stuff. And it was more because I was just getting harassed constantly, constant bullying, constant harassment. And that never really stopped as I was getting older and growing up. I was a victim of a lot of sexual trauma, physical trauma and abuse, verbal abuse. The person that raised me, my grandfather was abusive to my mother and my uncle as they were growing up, which in turn then, the cycle kind of perpetuated with me. And so I was growing up gay. I had been abused. It was a difficult childhood for me, really. And then as I got older, so when I turned 16, everything kind of just fell apart. I ended up in the hospital on drugs, and, I was raped at a party and lost my virginity that way. And, all these things happened to me. And I was like, I'm going to die, you know? And so I stopped doing drugs. I got clean. I went into 12-step programs until I was 24. So I was kind of the darling of those rooms, because I was so young and clean. But it saved my life.
Mm-hmm.
And I met a lot of lesbians there that were older that took care of me and made sure that I was okay. And I've never forgotten that's that community. And, they basically rescued me from a terrible family circumstance. And I was still super butch, almost like Leslie Feinberg's Stone Butch. I didn't have orgasms when I had sex. I didn't let people touch me, and it was all about the image and what you're going to wear out to the club or whatever you were doing. And growing up in Miami was wonderful, as far as subculture and DJ culture. And you could be punk one day, a hippie the next, and then go to the gay club, or go to the goth club. And so it didn't matter. It was really a great way to grow up in that respect. And then I went back to school. I started studying art. I met someone who was my first long-term relationship there. And she was the first person, I think it's 2003, that I ever told, I think I'm a boy. I think I feel like a boy. And she didn't judge me. and then I just kind of put that to the back of my mind. And then I was like, got through school, was just starting graduate school. It was first semester. My grandfather passed away. So like he was like the big person in my family that like I thought was going to live forever because he was my abuser and my mother's abuser, and my uncle's abuser. And so that was like a lot of like I had to like clean up after that. So I kind of grew up a lot. But then the woman that raised me passed away the last semester I was in graduate school. The first time I was studying fine art. And um, that's when I started going to therapy at my college because I didn't have health insurance. And so I went and did about 6 months of therapy and got my letter from that person and started taking testosterone that spring. I
Wow.
really went to that therapy to recover from the grief of losing both of the people that had raised me essentially in like a span of 3 years. So when she died, it was like very sudden. And I felt like I don't have anybody to answer to anymore. I can do whatever I want. And I was, then I just went into transition. Um,
And how old are you then?
I was 31, 32.
Okay. And
So
a couple of questions about.
sure.
So I'm really sorry to hear about your upbringing. It sounds really tough, and we see a lot of similar, I guess, past abuse in trans people, people who medically transition and also detransition. So it seems to be kind of a confounding factor. But I guess when we think of the notion of gender dysphoria, I think of both the social role and then the body. So did you grow up still into your 20s? Did you feel that dysmorphia over your sex body, or was it more of the role?
It was the role. I mean, I used to say like I never disliked being a woman. I was very proud of that growing up. But really it was
Okay.
like all of the outside pressure of like, I mean, I would go in a bathroom and the person would go tell the manager there's a man in their women's restroom, because I was so butch. I was so, super short haircuts, you know, um, piercings. I was dressed like punk rock half the time, like, and I also worked as a line cook in kitchens for a long time, for like 18 years while I was in school. And, you know, and those are horrendous places to work for the most part, especially as a cook and being young and gay and a female. It was really a harsh environment. But I would like go to the restroom in these restaurants, and the customers would be like giving me the evil eye or shielding their children, or and that's tough after a long time. Or comments. I had lots of girlfriends that were like, well, it would be great if you were a guy, like I would like you more if you were a guy. Like I would stay with you. I mean, I had women I dated that like wouldn't go out in public with me because they were straight. Like in Miami, everybody's like a little bisexual, or at least they were in the early 2000s. So I had trouble dating girls and like that kind of thing. But like getting somebody to take me seriously, getting somebody who like loved, like wanted to be with me no matter what, like my first real long-term relationship with this woman Natalie, and we're still like best friends today. She's family to me today. Was the first time I was with somebody who was just like, be what you want, be who you are, and like accepted me. But the environment that I grew up in is so misogynistic and so just really harsh towards gay women who are like not fitting into I could be
Yeah.
gay if I had long hair and if I like dressed a certain way or if I had money, or but I couldn't, occupy a space and just exist.
Yeah. Well, first of all, you're not the first person I've heard, the first female to female, I guess, person say that they were dating a woman who actually planted that idea or expectation. So that's very unusual, but it must happen.
I
And
mean, it happened
then
to me more than once. like like it wasn't just a
that's
one time.
crazy. And do you think this is like they're a lesbian, but they have this internalized homophobia, or?
I think they were genuinely straight.
Oh, okay.
Yeah, I mean, I've
Interesting.
dated quite a few women, like in my early 20s and late, before I met Natalie. I dated a lot of women that ended up straight. I mean, I'm good friends with a couple of them. I dated a server in a restaurant that I worked with, and she ended up getting pregnant like right after we broke up, and I broke it off with her. And she's got kids and a husband now, and super happy. And like, it's just
Yeah. Female sexuality tends, I think it's a little bit more, you meet some women who just happen to make a strong connection with the woman, and then things change a
absolutely.
bit.
The person I was just talking about, like, we still like chit chat every once in a while, and like, I think it was like when I was with this person, it was the first time she was intimate with somebody I think that really cared about what she was feeling. you know and like, oh, like, are you enjoying yourself, am I doing this right, like that kind of thing.
Sure.
Back then, most of the girls I dated like had never had that type of attention.
That makes sense. Yeah, and I have to say that I've never heard a trans story of a gay person who does not describe lack of social acceptance for their gender nonconformity. And it also seems like in boys, it's like the super hyper femme ones, who really just can't find a place for them in society. And then that sort of gets a bit directed at the body. I'm not sure if that did with you, but it's awful. I mean, there's kind of a lack of understanding, I think, from a lot of them on that. I remember I was talking to a trans woman who is currently happy with her transition, but she was kind of, I was asking her, so, did people try and curb your femininity as a boy? Like, was that a pressure? But she didn't really understand the question. She kind of thought that that's, she thought I was asking, did anyone try and stop you from transitioning? And then she said, oh God, when I was a little boy, if I did a twirl, my father would be like straight on me. And then I was kind of there like, okay, that's the connection I'm trying to make, but she wasn't making it. So I didn't want to infringe, but it does seem quite typical of a gay person. And it's just really sad to me, because it's like, if you were accepted just for who you are, despite being female, then,
Oh, things would have been so different.
Yeah. And so when did the idea of actual transition, how did that come about?
Well, so there was, I know I mentioned in the free press article, the documentary Transgeneration. So that was, I remember watching that and being so uncomfortable, like horribly uncomfortable watching it, because I felt like it was like telling my secret, or something, like how I felt inside. And then it was scary because seeing all these people like doing this transition and like living their lives and being okay and like being really happy. And then, I just pushed it to the back of my mind. A couple of years passed, I ended up going to art school with Natalie, and I started towards the end of art school really struggling with my gender and how I identified. And so I made like a lot of artwork about it. And so my final thesis piece in undergrad was I painted in tempera paint, 14 feet tall, a giant strap on the wall. And it was like amazing. And like really beat you over the head with it. You walk in the gallery, it's like the first thing you see. And basically, like the cohort I was in with, they all did like sex art for so there was like a sign at the front of the door. And but it was an important thing for me to do. One, because it was like I was discussing like, this is, the like when you're a lesbian and you're ready to use the strap on, it's like the real deal, right? Like it's like serious relationship. And like in any movie where they've ever had
Right.
to like talk about it. I remember at the time, like with Natalie and I talking, we were like, well, anytime they pull out a strap on in a movie, like they don't really show it and it's super awkward. And like, how do you discuss this like penetration and like all these things happening? And I was like, this is the closest I'll get to having a penis, And like, so that was kind of like what the piece was about for me. Clearly I needed therapy or something to figure.
Yeah.
I wish I had been able to like figure these things out sooner, but I guess that's a part of growing up too, like, so I don't regret any of it. It's just more of like, now at 44, I'm like, oh, okay. Like I know what was happening now.
Yeah, it's like, I mean, I feel like someone from W Path would just say, "Oh, it's just another step of your gender journey." That's how they put it when they hear of someone detransitioning. Can you talk a bit about? You said you're going to therapy, and then you ended up with that letter. So
So
what was that process, and how did you end up? Subscribe to my Substack, Jack Jewell Uncut. This is where you will get my full, uncut, untamed, and unashamed takes too controversial for YouTube, including early access to all videos, a private members chat where you can talk to me, and bonus footage seen nowhere else, including this episode. Do you relate to this kind of autoandrophilia type phenomenon of sort of, where did you sit on the whole trans women are women? Did you believe that you were an actual man? Did you experience the vaginal atrophy and some of them need to get a hysterectomy? How many people truly benefit from this? Do you believe in the kind of true trans notion? Link on screen and in the description.
I really, and a lot of people are really angry with their therapists and doctors that are detransitioning. And I think for younger people, they should be. I was an adult, and I had an excellent therapist at that school. I got so lucky because aside from the gender stuff, like I was destroyed when the woman that raised me passed away. I could not function. I mean, and I should have taken the semester off, but I just didn't know any better. But I had this person really help me get through that grief. And then once we had talked through that and I was like kind of more in a stable place, then I felt safe with this person to talk about these feelings and what was happening. And I don't think she was a bad therapist at all. And I honestly, I think some of these doctors, like not necessarily all of them, but the one like my endocrinologist, like I don't think she wants anything bad to happen to me. I think a lot of these doctors think that they're doing the right thing and they're following this procedure and these guidelines, and then they're not questioning it. And I think my therapist at the time, this is 2012, all this stuff is just exploding in the media, that's where I watched all, everything. I watched all these people's transition diaries on YouTube and this, that, and the other thing, because I was like, what is this like? What is this like for them? How's it going? Like, do they pass? Do they not pass? And so once I was like in therapy talking this out, I don't know if I like convinced myself or like what, but I was like, this is the answer. And nothing was gonna stop me. And so I also like met another trans person in the area, and I had never met a trans person before, and like had coffee with them, and I started going to a support group for other trans people, and um, you know, got in a relationship with a woman who, was like, as I was beginning to, name myself Tiger, and like, we were together for a couple of years, and it was just like, it was basically like full throttle, like I'm transitioning. And I really thought that that was the answer for me. I really did.
Yeah. Were you still really unhappy being female at the time, or was it more of the excitement of being something different?
I just had like, it's so weird to think back now, because the way I feel now is like completely different. I really like have a complicated relationship to my sexuality and my intimacy because of all the trauma. And that is, now, now at 44, I finally feel a little bit of peace about that. Um, Actually, like through going public about detransitioning and like writing my story and like having to do a lot of writing and introspection and like, things like that. Like I've really like this shit was not my fault. These things that happened to me have horribly affected my interpersonal relationships, have rippled out into everything. And I don't think I would have transitioned had I not been abused. And I knew that that connection was there before, but I couldn't figure out how or why. Um, and, I had a nice body at the time. I was cute. I had a nice face. I had nice boobs. My butt was nice. Like things looked good, and I just I had terrible periods. I had endometriosis. I would throw up every time I got my period. I would miss a day of work or a day of school or 2 days, depending on how rough it was. I had bad hormonal roller coaster. I cried all the time. And so like that was what was really distressing for me. if I had gone to a gynecologist that said, hey, like, here's an IUD, or here's like something so you can stop your periods or like not have this pain, that would have that would have radically changed my life. Just something like that.
Yeah.
But I didn't have insurance or healthcare at the time in that way. I didn't know, like, nobody was presenting me with any other options, even the therapist. Like, there was no like, hey, like, have you tried to
Crazy.
think about this or that? And I think it was just because I was that convincing or something. Like, I just don't know.
Yeah.
I wish that there had been somebody to say, like, aside from like a couple of conservative family members who were like, why can't you just be gay? And now I'm
Yeah.
like, well, why did I listen to them?
Did you feel any internalized homophobia? Like, was the idea of being gay something unsatisfying or distasteful for you?
Yes and no. Because I was so aware that I liked girls very young. Like, I was 12, I think, when I was like, oh, I think I like this girl, and not because I was like making out with boys and trying to like see what was out there, and there was no emotional anything. The first time I kissed a girl, I mean, the world stopped. We escaped out her bedroom window and went to this park in Coral Gables and the golf course and in like a little gazebo, and she kissed me and I died.
Right.
It was the best thing ever. So like I never
Mm.
questioned that. It was like all these other things that were happening in my life that were like far beyond my control. So being gay was
Sure.
easy. Um,
Yeah. So what were those early stages like with taking testosterone and transition? I guess on a physical level, and what was your life like?
it was crazy. I mean, I started taking tea. It was very exciting because I wanted to see the changes. I wanted sideburns. I wanted a beard. I wanted all that stuff. And they didn't like,
Mm.
it took about a year, 2 years for things to really like, for me to really start passing. And now I'm like, God damn it. I wish I would have stopped then, you know?
Yeah.
But like the first things I got was like hairy, and my butt and my back. I got the sideburns first, so I walked around with mutton chops for like quite a while. I had like a little mustache and little Elvis sideburns and thought I was the shit, which I kind of was. Like, I'm not gonna lie, I had like pompadour and I was pretty cute, but it was really like I it was very quick that like my emotional side just shut down. So it's just like emotionally numbing myself. Um, I was much more volatile, like as far as like being angry. My skin got thick, the way that I perceived the world was just a little bit different. I started getting muscles, that kind of stuff. I was lucky at the time. I had just graduated with my Master of Fine Art, which meant I was a line cook again because I didn't have any money behind me. Showing my work here and there.
Yeah.
I wasn't under the impression that I was going to be like this hot new artist. But I got lucky because I worked at a place where I had just started tea, so I very much looked very female still. And then I just told them like, hey, I started tea. I'm going to be using the women's restroom until I can't anymore. And they were like, okay, cool. What do you want us to call you? Do you want to, and I just transitioned in this place. So my transition story is like really one of privilege, support, acceptance all the way through. I've never had a problem.
Mm.
Taking the tea, what really started to become a problem, probably like, I think a year into like being with Jamie, maybe like, a year, 2 years in, was like, when we fought, like, it was like, she couldn't tell what I was feeling. And to me, and I don't know how that works for you as a man, but like, I have all these feelings and they're just all under the surface. They're all like running around here. And like, sometimes you can tell by my face, but most of the time I just look angry. And I couldn't cry. Like my cat died and I cried. We put our dog down. I cried, but that's it. Like in 10 years, I've cried like 3 times, um, and that became a very, very big problem for me. And the biggest motivator for me to detransition, or even just to get off the tea, was the emotional impact it was having for me and on my relationship and on my family, where, you know, I was not a nice person to be around and I didn't feel good about who I was a lot of the time. Now
Yeah.
I've never had a problem passing, had a problem, but that also presented problems for me emotionally too, where it's like, I'm no longer viewed as gay or any of those things. I'm treated like a straight man. And the other thing that T did to me was make like I suddenly was attracted to men, which was like very uncomfortable for me and not something I wanted to pursue, even though it was like a turn on. And so that's hard
Mm.
to because it's not a thing for me before. I was open
Do
minded.
you have any? Do you have theories about why? Like, is it kind of like your sex drive is just so much higher that you just sort of it's just humans in general? Or
I
what do you think?
I think also like it's like watching gay porn in some respects. It for me it became more about a visual than like an emotional. Like as a woman, I would like if I'm getting off, it's like the feeling. I'm closing my eyes. It's about how somebody's touching me or how they're looking at me, as opposed to like on T, I can rub up against a doorknob. You know what I mean? Like I've had to use that, but like
Yeah.
much more visual. It's much more of I think, being attracted to gay men was for me more about the power dynamics involved in some of those scenarios. But it was also like a very scary, like almost taboo subject for myself. Um,
Yeah. Mm-hmm. So on reflection, while you were taking tea, would you say were there parts of your life that felt a lot better because of that, or
yeah,
like how do you feel about the benefits overall when we think of?
I think the first like 5, 6 years, I was really all about it. Like I really felt happier. I was, I started another graduate degree. I had a family. I was, married. Um, you know, but I will tell you, like transitioning is the weirdest experience to describe and to live. I felt really like, like Jamie and I identified as queer and like, but no, were never perceived in that way. We had no community. Um, we went through a contentious custody battle, with her two older children, and they used me being trans as like ammunition. That was very difficult. But even like all the way up till now, on a day-to-day basis, I'm doing an assessment in my mind anywhere I go. What do these people think of me? Do they respect me? Um, do they know that I'm a female? How am I going to get my body back? What am I going to do? Like there's always like a safety assessment happening. Even though the threat is not necessarily real. I think for trans women and trans women of color, I think that the danger is very real on many levels. Um, aside from their
Sure.
own mental health and that sort of thing. But for me, like, unless somebody sees me that I have a vagina, like, I think I'm safe, for the most part.
Yeah, yeah, yeah.
Um,
I
that,
think, yeah, I've heard a lot of trans women have, in particular, this kind of underlying neuroticism all the time because it's, do I pass? Is this person, are they clocking me? Like, that must be difficult.
it's also like, what does the person really think of me? Like, are they, like, I'm always kind of like, do they accept me? Like, and it's not like a conscious thing. It's just like a quick assessment, like, but it's hard to move through the world like that all the time. It's so hard.
Yeah.
It's hard to raise kids like that. It's hard to, like
And you got top surgery?
I did. Yeah. In 2016, I got top surgery. I paid all of $150 copay for that. I had two surgeons. So I had a
Wow.
plastic surgeon and I had a breast surgeon who did the surgery. So the results were fantastic, actually. Like
Yeah.
you can hardly see my scars, that kind of stuff. I still have sensation. My original nipples are still there. Like amazing. Do I miss my breasts? Yes. Yeah. But part of the
I mean, were you happy to have them gone at the time?
yeah, partially because I had like my hairiness runs in the men in my family, so I was like super hairy chest with breasts, and it was like crazy looking to me, and I really felt like a freak,
Yeah.
like a total freak with that, and it was like I was binding all the time, I was hot and sweaty, couldn't breathe, all these things, and Jamie and
Right.
I I work for WashU, like, let's do this, you know? And I was like, okay, you know, and we did it. And like, you know, she was there for the surgery. She was super supportive. Um, she took care of me after, you know, and I remember just being really sad after that, like, and just like looking at these tubes, you know, and all the recovery and stuff and just being like, what did I just do? But it really was, I'm a really pragmatic person. And part of the reason I did it was because if I was like, if I'm going to stay like this, I can't do this for much longer. And
Yeah, yeah.
and I'm never going to fully pass or feel fully comfortable if I don't. And this is going to create more problems than not, you know? And I was like, let's just do, you know, like, and I've never had
Yep.
a problem with, you know,
Yeah. I mean, we do see some non-binary TikTokers take tea, but they keep their hairy breasts, which is an odd
I'm like,
sight.
that's what I'm like, no, I'm so
Yeah.
vain. I'm like, I just can't, um, you know?
Um, did you consider phalloplasty?
Yeah, I thought about it. I looked at all the pictures. I looked at the metoidioplasty, but I will say this: that's the best choice I ever made was to keep everything. You know, for the most part, everything is exactly as how I was born, and it feels great and works great. And you
Good.
know, because the way that I am, I wanted like the Cadillac of dicks. You know, like I wanted something that was going to look nice and work right, and you know, have sensation and things like that. I don't want to be like dribbling on the toilet, like, or, you know, in my pants the rest of my life because I had a terrible surgery that doesn't look right or function correctly because I'm not a man. You know?
It's such a brutal surgery, that one.
I just, you know, seeing all the pictures, Jamie and I had talked about it a few times and like, it's the best choice I ever made. And also because I like that body part. It's mine, you know? And so that's kind of like where I drew the line as far as like being trans. I was just like, I'm fine with my vagina. I'm gonna leave this the way it is. It's that's not, I don't have beef with it, you know, like it's
Yeah.
I'm so glad.
Yeah. I'm very glad too. So how about we pivot a bit to, you know, what started making the pennies drop for you on reconsidering some of this?
Well, somebody blew the whistle. And so when Jamie blew the whistle, it was really
Could you give just like a really quick overview of in case anyone's not familiar with that story?
sure. So my spouse, we're still married for now. um, Jamie, you know, was a pediatric. She worked at the pediatric transgender center here for kids at WashU, and she was a case manager. So basically, she did all the intake calls and was like on the executive team for that center. The center was run by an endocrinologist and an adolescent medicine specialist. There was a nurse that worked there. There was a couple of psychologists and one psychiatrist, I believe. Very small team. The administrators who oversaw the team, you know, as far as I know, were not in the same building, or at least Jamie's supervisors did not directly supervise her at work, which is different than what I'm used to in any other job. And so in
Yeah.
the beginning, you hear gung ho and, you know, very all excited. Everybody we knew was excited she worked there, you know, because she was going to be helping kids. And that's something about Jamie that she's been teaching swimming lessons for 20 years. She's always worked with kids in church groups, things like that. Children are like very important to her. So like she was really excited to be helping people, but it quickly became disenfranchising probably about a year in, 2 years in, when it was like this explosion of patients. So they had all these people coming in from all over the state and other places. Um, and the kids started having like comorbidities and different diagnosis that needed to be addressed, and it wasn't. And they were still just getting the blockers and the hormones. And she was like, you know, having to, and I'm careful to talk about this, but like I know that what she was saying and what she put in her affidavit is the truth because it was COVID and I was there, you know, in the house. I was there. I didn't know any like identifying patient information or any of that, but it was more of like, you know, she would do these intake calls and these people would be needing having all kinds of questions and needing all these answers and thinking that this place was a one-stop holistic shop. And they were like, no, you have to have your own therapist. You have to, go see your own psychologist. Like we're not equipped to handle that, you know. And these parents are like desperate because they want to take care of their kids, and they're like, what do you mean? Like I don't even know where to go or what to do. And she would spend a lot of time on the phone with these folks, like trying to get them help and trying to give them, so that wears on somebody after a while. And when these kids were coming in and wanting to be identified with like crazy pronouns like mushroom or like, like it, or, and most of the girls were autistic and like that kind of thing. Like she and her colleagues outside of work started like being like, we're not okay with this. Like we don't think these kids are really trans. Like we don't think these kids need, And so when she started raising issues with the people at the center, she was getting shut down. She was getting bad
Yeah.
reviews. She was, basically like pushed out the door. And so she quit working there and started working as a clinical research case manager, which is like just working on research studies and that sort of thing. And she did pretty good there. But she was so upset about what was happening in that clinic, she just couldn't let it go. And so when that started happening, I just shut down. Like like shut down. I don't know how to explain it other than I could not be a part of what she was doing. I was so indoctrinated and so in denial about myself, about what was really happening. I was not even willing to have a conversation. Like I knew the office was mismanaged and I couldn't stand her working there because I just thought they weren't professional. But I mean, because doctors like in that position should not be managers of other staff. Also, I just unless they have management
Right.
training, like it just wasn't.
Yeah. Yeah.
But
Mm-hmm.
I never doubted what she was saying, but I also didn't agree with kids being on blockers or hormones because it was such a radical change in my own life as an adult. Like I was like, I would never have been able to handle this at 12 or 13 or 14 or 15. Like there's no way. I was crazy.
Okay.
So
Yeah.
she started, she read some other books from the other side. She was like, I'm going to read some books from the other side now. And I was like, okay, cool. Like whatever. I'm a librarian. Like I dig it. And then once that happened, she kind of like the light bulb went off for her and she was done. And so she started reaching out to people and organizing and that kind of thing. And then she, was like, I'm doing this affidavit. And I'm like, yeah, okay. But I just shifted the focus to my kids and my job and just kind of, I was like, do what you want. Um, and the night before her story went public, she shows me this article and I died. I was like, what is happening? Because she mentioned in there that I was trans and like all this stuff. And I was like, they're just fucking using me to make your story seem legitimate. And so we were at odds for quite a while about that when she went public.
Okay.
It was such a
Mm.
stress on our marriage and our relationship. I was pretty terrible. And I was already being a terrible person to be around a lot of the time because of the tea and because of just not knowing how to manage my emotions correctly and things like that. Which I had a
Mm.
lot of shame, and I still do. Uh, but it was something I just stuck my head in the sand. I was so scared. I was so threatened, so scared, I felt alienated. I felt, you know, made invisible. Like I thought she hated trans people. I really thought Jamie was transphobic. Um, People stopped talking to us. Our close friends, like stopped speaking to us. So that was a lot for me.
So I just, I couldn't, in the beginning, just couldn't believe that she was just unable to like let it go and just couldn't just quit her job and like move on and continue with our lives, as normal, regularly scheduled, and it took me a long time to wrap my head around like she cares about kids, they're harming kids, she has to do something about it. Jamie grew up as a like anarchist activist and is really good at organizing and has that background. So she was taught by her parents, who I love, you know, to do right by her conscience, you know, and to stand up for what she believes in. And as a trans guy, I had become afraid. So like when there was a couple of verdicts here in St. Louis, like 2014 was Michael Brown, and you know, I was living here at the time, working at the library, and I was appalled by what was happening. And then when the Stockley verdict came in later, I refused to go to any protest because I was scared to death. I didn't want to get arrested. I didn't want to go to jail and have to deal with that as a trans person. I feared for my physical safety, like all these like irrational things, you know. And so when she went public, I was afraid. And we had like actual things happen where like we lost relationships in the community, you know, and it didn't just affect her, it affected me. And so initially I was very angry, which was a normal feeling I had much of the time. Um, Not that I had a bad life or anything to be super angry about, but that's there you have it. Um, and she, you know, was like, I have to do this. And I'm like, and there were so many conversations where she's like, if you're against this, like, I'll stop. And I'm like, but I'm smart enough to know that this is like something you're really good at. And some, you know, and I was like, even if I'm not in agreement with this, she is standing up for what she believes in, which is more than I can say for so many people I know, you know? And so I like really respected her fortitude and like her dedication to seeing this through, you know? I was scared to death that she was being co-opted by the right wing. I was scared to death that this was going to annihilate all trans rights, you know, because I really bought into that. And I was really fervently
Yeah.
about like, you know, I'm a trans person. Like, how could you be working with the state attorney general in Missouri? Like, what are you doing? Um, and that caused a lot of discord just in our marriage. We're raising, you know, 5 kids. I'm chasing babies all the time. You know, it's
Uh-huh.
that's been the greatest blessing in my life. I'm so happy I'm a parent, but um, you know, it was very stressful for the both of us because I think she's like, but just look at the science, you know, like, why aren't you looking at the science? And I'm like, fuck your science, you know? I mean, I would say things like that. Like, I don't care. That's not what this is about for me, you know? And so we were both like banging our heads against the wall. And then it took us separating for me to take a hard look at myself and what was going on. I mean, I've been with Jamie for 9 years. We've been married for 8. It's not nothing to me. You know, my family is everything. You know, everything to me. Um, I'm getting emotional now because I can. Oh my god. Um, you know, and I had been talking to my endocrinologist for a couple of years. You know, about when can I stop taking tea? How old do I have to be to not have to take this anymore? You know, this is negatively affecting my health at this point. Like, what can I do? And the first discussion was, oh, you need to have a hysterectomy. I don't No, I don't want to
Mm.
do that. Thank you very much. I want to not have a major surgery again. And so they were like, you can do that, or you can, you know, there were a couple other things they suggested that I wasn't ready to hear at the time. But it was like always there. Every time I went, you know, twice a year, I just go and talk to her again. Like, how can I stop taking this? How can I stop doing this? So I always knew that like I didn't want to be on T forever. And then in the last year or so, Jamie's like, you being on T is what's like hurting you. And I'm like, oh, it's not. Like, I was so stubborn, you know, like just so headstrong about it. And you know, when presented with losing the most important relationship I've had in my life, I was like, maybe I should start, you know, I remember talking to her and being like, you know, I wish we could have met each other in the middle about this. You know, I wish I was more open minded so that I could look at what you're talking to me about. And I wish you could understand like how I feel in this situation, you know? And when I said that, I was like, okay, it's time. And I started like looking at detrans Reddit groups. I started looking at, you know, some of the literature and things that are out there. I started reading the Cats review. Um, I'm a librarian. Like, why wasn't I doing this already? But sometimes you're just not
Right.
ready to like face things in your life, and so
And
I
when you were asking about getting off tea, is it not just as simple as stopping taking it? Like, what did you mean by how can I get off it?
It's not. It's not, because what happens is if you stop taking tea all of a sudden, it causes menopause like symptoms. So like
Uh,
if I miss a shot and I'm not like prepared, like, so like in 2023 I went to the American Library Association conference. I was supposed to take my shot that day before I got on the train and I forgot. So I had a whole week where I didn't have my shot and I missed a shot. I was irritable. I was profusely sweating all the time. I was having hot flashes. I just felt disgusting, and just totally uncomfortable. And so like it really, and I was like basically going on a hormonal roller coaster. So like it's not suggested for any buddy that's been on T to just stop taking it. And so
right.
what I've been doing now is I'm on like a 50 milligram dose every 2 weeks, and that's like I'm on like the first couple of weeks of doing that. I've been slowly tapering down, and like last week was pretty difficult when I missed that what I would normally have as a weekly dose. There are definitely like some emotional moments and some tears shed and stuff like that. I've also been so the route I'm on now is I'm taking birth control, monophasic birth control. So it's like I'm just taking the pills and not the placebo. So that way it's like as I'm tapering off the tea, the estrogen is there and I won't get my period again because I'm still probably going to have a period until I'm 50. So they were like, we'll keep monitoring this or whatever. Um, so I don't know. I mean, I'm thinking of stopping in the next couple of weeks, like, doing maybe one or two more doses and then stopping and seeing what happens. Um, I wouldn't say I'm definitely apprehensive, but like I just want to be done with it. I really am just tired and I just want to be done taking this stuff.
Mm. And how do you feel about your more masculine features now, like the facial hair or this kind of stuff?
I'm kind of ambivalent either way, like I want to feel better more than anything. I don't care about how people read me. I know that I'm a woman. I know that I've always been a woman. It literally took me, I remember talking to Jamie and she said something about my biological femaleness. And I was like, how dare you say that to me? Like, how dare you call me a biological female? Like, I was so offended. Like, that's how entrenched that thinking was. And then I listened to, Benjamin Boyce on conversations with Ben Ryan, and like Ben Ryan was like, I just don't understand why all these trans people like deny their biology if they're taking cross-sex hormones. Like, if you were actually the other sex, you wouldn't need to take cross-sex hormones. And I was like, holy shit, that's true. Like he put it in such simple terms in a non-judgmental, apolitical way so that
Yeah.
it clicked for me finally. Like, and as soon as that happened, I was like, I'm done. I'm just done. You know, like
It is. I mean, the indoctrination is so powerful, isn't it? That quite simple logic doesn't penetrate.
it doesn't. And I think it's like it's it's easy to go off the deep end and be like everybody's woke and all this stuff, but most people are kind of in the middle. Most people are in the middle. Most people, if they know somebody who's trans or whatever, they're going to try to be accepting. Most the problem I had the last 5 years or so, is oh my god, like there's no room to have a different opinion in that community. There's no room to say, hey, like I don't feel good about my transition anymore. I don't feel good about how I'm treating people around me. I don't like how I feel. Maybe I'm not trans. Like that's like unheard of. And so that's the main reason I went public, was to be like, there are people like me that are older, that did this as adults that are transitioning back. When the story came out, there's a woman that I went to support groups with, who had fully transitioned as male. We were buddies, and she reached out to me and said, "Hey, I detransitioned too." and my name is such and such now. And I was like, oh my God, like, and I looked at their face and they did, and they're living a happy life, so I felt a little less alone in that respect. I kind of feel like a freak now. I'm not going to lie. It's hard, I want to have the money to do laser, hair removal on my face. Like right now, I want to have a hair transplant so that my hair will grow back the right way. Um, you know, I would like to have breast chest reconstructive surgery at a certain point when I'm ready for that. Um, I want to be able to explore my femininity in ways that I had been unable to do so before because of the trauma. I now like, and I don't want to
Right.
be girly by any means. You know what I mean? Like it's not like that. It's like maybe it's a more of a form-fitting T-shirt or like a women's cut jean or like, but like still maintaining my style and like how I dress or whatever. But giving myself that chance. So like things I've started doing, I shave my body hair now. It feels great. It's not uncomfortable. I'm gonna get my ears pierced again. Like small things like that, that are affirmative in that way for me as far as detransition goes. My job has been really supportive. My close friends have all been like I called all my close friends before I went public and said, "This is what's going on. I'm cool if you don't want to talk to me anymore, but I have to do this." You know, I'm sure some of them think I'm crazy or that Jamie's like indoctrinated me or whatever, and like that's not true. I just can't reasonably continue living as a trans man when I know that my biology never changed and that I'm unhappy with the results. I have diabetes type 2. I have high blood pressure. I have high cholesterol. I take medication for all of those things. I have to take Ozempic. The weight loss is great. I'm not going to lie. But other than that, like I've got to take that forever, I lost a bunch of my hair. Like I just, I'm going to be 45 in February, and this stuff is hard. Like, Jamie and I are separated now. That's tough. That's really tough for me. The cool thing about it is we work so much better as friends and as co-parents, and we agree about how to raise our kids, and we love our kids and we put them first. So, I have a lot of hope for that friendship, and I plan on working with Jamie in the future to help detransitioners. So like, we're very much present in each other's life. We very much support each other. We very much respect each other, and we get along now. And like the last like few months, like we've gotten along better. I mean, there's been ups and downs, clearly, like when you're separating from somebody, it's unavoidable. But and we have so much history, right? But at the end of the day, like I'm hopeful because I would much rather be best friends with her as a parent to our kids than be miserable in a relationship with somebody, that is not right for me. I'll meet somebody else down the road, but like to build a future um, where young adults who are detransitioning can feel safe or can feel like there's a way for them to get help and to feel better about their lives, like that matters to me, a whole lot. And so that's why I went public, was because I was like, I could never imagine being prescribed puberty blockers at an early age, 12 and up, 12 to 17. I was insane. There's no way. And I don't think minors can consent, and I don't think their parents really know what they're doing, because their parents, like a lot of like I don't even know if my friends and people I've come across actually understand like the results of like male to female bottom surgery, or like what you know like what does that actually look like, or like how to like I didn't know that young trans women may never, who have transitioned like before they're 18, may never have an orgasm. Like that's atrocious to me.
Yeah.
to
Yeah.
to rob
Hmm.
somebody of that life experience, that most wonderful of life experiences, like, you know um does a parent really know that they're agreeing to make their child a eunuch? Like I don't know, like I don't think they think of it in those terms, and that just makes me really sad, and the same thing for these young women that, it's misogynistic. It's, if they have other mental health issues, if they're autistic, like man, you should be doing stuff with that before you're pushing your kid to have gender affirming care. Like, adults,
Yeah.
my stance as far as adults go is you're an adult, you make your own choices. If you want to detransition, cool. If you want to transition, like, I don't think it's great, and I think your doctor should give you a lot of different options, and there should be a little more gatekeeping. Um, but I'm still kind of like in the middle of the road with that for right now, just because of my experience. Like, I don't think I could be any other way. And I think detransitioning for me is very much a part of the reclamation of my femaleness, the reclamation of like what I lost when these people who violated my body took what they took from me.
Hmm.
That's it's a
So
big part
is
of it
it?
for me now.
Yeah. Well, it's very powerful. You've learned all this. Every detransitioner I speak to seems to understand themselves on a very deep level, and they continue to learn more and more because you have to unpack so much. And yeah, I mean, how does the future look for you now? Are you feeling positive or?
I take it a day at a time. Like I said, like, I'm really grateful to have the people I have in my life. I love my kids. I love being a parent. They're wonderful. It's not always easy. And even like, I'm like, how is this going to work with my kids later? It really doesn't matter. It's going to work the way that it's supposed to. You know, we're very age appropriate with them, that sort of thing. They know me as dad. I'm not going to make them call me something different or anything like that. Um, but I'm hopeful, like, I like, where I'm at right now. Like I said, Jamie and I are talking about, ways that we can help detransitioners in the future. And I'm really grateful to have her in my life as a friend and as a family. She's my family, like, that's just what it is. And um, I'm hopeful. Like I said, I want all this facial hair to be gone. I want my hair to be back, and so those are things I'm slowly working towards. So I have like set goals. I work in a helping profession already, so I enjoy that quite a bit, and I'm just grateful to be where I'm at, and I'm grateful to
Yeah.
have the courage to do this.
Mhm. Well, it's a very inspiring story. You should be proud of yourself, and I'm sure this will speak to lots of people, particularly women your age, I think, who've transitioned possibly or detransitioned. And I'm sure you guys will both go on to do a lot of good work. I'll keep tabs on it and see what you guys end up doing.
Well, thanks for having me today. I really appreciate it.
Thanks so much, Roxxanne. Thank you.